Hi everyone, this is Dr. Vinodini Bhaskaran and I am a consultant obstetrician and gynecologist who's practicing currently at Park City Medical Center as well as Srikota Medical Center. And I have an experience of over 20 years in this field. And between you all and me, we have one thing in common, that's our esteemed university, which is UCSI. I am a proud alumnus of this university, and I did my MSc in healthy aging, aesthetics, and regenerative medicine a couple of years back. And I would strongly recommend this course to all of you. And the reason I would recommend is because it has helped me go a step further in my clinical practice, and it opened my horizons to a newer field, new upcoming field, which is a healthy aging, regenerative medicine, and aesthetics. And it was very helpful to put all this into my day-to-day practice. And I would take this opportunity to thank all my lecturers and professors who have helped me a lot during this course. And that is one reason I would recommend. The faculty is very, very helpful, and they take you through step by step and help you to complete the course without any problems. So I would highly recommend this course to all of you. And if you would like to have any queries, you can actually go to the Facebook page, which I will show you in a short while. Allow me to share my screen. Yeah. So you can go to this Facebook page, as you can see here, and the QR code is there. So you can scan the QR code, and that directly takes you to their page. So without much further ado, let's get started on the topic, unlocking the unlimited potentials of umbilical cord stem cells. And the objectives of this lecture are, we're going to have an overview of the stem cells, the categories and the sources of stem cells, and umbilical cord stem cells, their applications and experimental therapies and clinical trials, potential uses in future, cord blood banking, its current status in Malaysia, public versus private cord blood banks, whether to donate or to discard. All these we will discuss in the next 1 hour. So, what are stem cells? Stem cells are defined as biological cells that are capable of self renewal and also have the capacity to differentiate into a variety of cell types. So, to be a stem cell, basically, it should have two qualities. One is self renewal, which means the stem cell must be able to go through multiple cell division cycles while remaining undifferentiated, which means it should produce identical cells, the same like itself. And another is its potency. The stem cells must have the ability to differentiate into specialized cell types. And in this picture, you can see there's a fertilized egg. You know, all of us start as a single cell, and then the next would be the blastocyst. Before the blastocyst stage, you have this totipotent stage, which is called as the morula, which is the eighth cell stage. And at this stage is where all all these cells by themselves, each of the cells can form a whole new organism. So this cell can form both the embryo and the extra embryonic structures like the placenta. The next stage, when it comes to blastocyst already, the inner cells of the blastocyst, they are capable of forming all the three layers, the ectoderm, endoderm, or the mesoderm of the embryo. So all the layers of the embryo can be formed, but the extra embryonic structures cannot be formed. Hence, they are called as pluripotent. The next stage would be the multipotent, where these cells are capable of differentiating into several lines, but their potential to go into different branches of cells are limited. The last one is the fully mature cell, which is not capable of differentiating into any other cell. So this is the hierarchy of the stem cells. So the zygote stage is when it has the maximum capacity to differentiate into all possible structures. And after that, it becomes the embryo, which is pluripotent, and the germ cell layer, which is multipotent, and the Other lineage stem cells like the hematopoietic stem cells, which are oligopotent, and the tissue-determined stem cells, which are tri or bipotent. And lastly, the terminal differentiated mature cell, which is nullipotent. So at each stage, as you can see, the differential potential decreases and the specialization increases, which is like take for example, if you've just finished your MBBS and you're a general practitioner, you're like you all also treat cases which is a derm in nature, or you also see children, you also see adults, you see cough and cold, and you also see lumps and bumps. So you do not have a specialization. So that is the totipotent stage, all potent. But after that, once you become a pediatrician, you only see children. So you become more specialized. And when you specialize in pediatric neurology or cardiology, then you go on to a specific niche. So only those cases you see. So that is how, as you grow further, the cells also similarly, as they grow further, their specialization increases and their differential potential decreases. So the potency of the cells, totipotent means it is able to generate every cell type, including the extra embryonic tissues. Pluripotent means the ability to generate cells from all the three embryonic germ cell layers. And multipotent means its ability to generate a variety of cells from a particular somatic structure. Oligopotent can differentiate to a few cell types, and unipotent means it can differentiate only to one cell type. And nullipotent, as I stated earlier, it's a terminally differentiated mature cell. So in summary, what is a stem cell? Stem cells are unspecialized cells which have the potential to develop into a variety of cells, and these go to the areas where there are injured cells and they replenish or rejuvenate them. And they have this unique ability of unlimited self-renewal to produce progeny exactly the same as the originating cell, and also gives rise to specialized cell types that becomes part of the organ targeted. So again, this is a summary of the potency of the cells. As you can see, totipotent has the full capacity to develop from each cell into a whole new individual, and these cells are only available from in 1 to the third day embryos. Pluripotent cells can form over 200 cell types, and these are available in the blastocyst, which means after fertilization from 5 to 6 days. That is when pluripotent cells are available. Multipotent is all the fetal tissue, cord blood, adult stem cells, all these are multipotent. These are differentiated but still can form a number of other tissues. Oligopotential, the best example would be the myeloid precursors. They differentiate into monocytes, macrophages, eosinophils, neutrophils, and erythrocytes. So almost 5 different types there. So they have limited capacity. And unipotential means they only differentiate to one type of cell, like the mast cell precursor, which differentiates into the mast cells. And nullipotential means they are already terminally differentiated, like take for example your red blood cell, and they cannot undergo any further cell division. So how are stem cells categorized? Stem cells are basically categorized or broadly divided into the embryonic stem cells or the adult stem cells, which are the tissue stem cells. The embryonic stem cells means from the blastocyst, a very early embryo, from the time of the zygote until the blastocyst is your embryonic stem cells, which is before 5 to 6 weeks of gestation. Afterwards, after the 5th to 6th week of gestation, all the stem cells are adult stem cells. These are some of the well-known sources of adult stem cells: the bone marrow stem cells, peripheral blood stem cells, neuronal stem cells, liver stem cells, muscles, mammary glands, corneal limbal stem cells, pancreas, salivary gland, and umbilical cord stem cells, umbilical cord blood cells, and the cord mesenchymal cells, amniotic fluid cells. All these are well-known sources of adult stem cells. And in pregnancy, these are the sources of stem cells. The IVF embryos, they give rise to this embryonic stem cells, especially if they are before 5 to 6 weeks of gestation. And the umbilical cord. Umbilical cord, both the cord blood as well as the Watton's jelly around it can give rise to the stem cells. And these are adult stem cells. And again, placenta also is a rich source of stem cells. Also, the amniotic fluid and the aborted fetuses. All these are sources of stem cells in pregnancy. So what are the primary differences between embryonic and the adult stem cells? Embryonic stem cells are pluripotent and can be differentiated to any cell. But adult stem cells are multipotent. Though they can differentiate into many, doesn't mean they can differentiate to all types. And embryonic stem cells have an unlimited self-renewal capacity, whereas adult stem cells have a limited self-renewal. And embryonic stem cells, because of the surge in IVF these days, they are easier to get. But adult stem cells is again, it involves a lot of invasive procedures, so a bit difficult. But the downside in embryonic stem cells, they are more tumorigenic, which means they can form tumors because of their unlimited growth potential. Whereas adult stem cells are not tumorigenic. And again, embryonic stem cells can also be immunogenic, and the chances of rejection might be more. And adult stem cells, the immunogenicity is much lesser. And also another unique problem with the embryonic stem cells is the ethical problems, because certain societies consider the blastocyst to be a live human being. So whether it should be killed or not. So those kind of ethical problems are there when we are using embryonic stem cells. However, adult stem cells do not have such problems. So coming on to our core topic, umbilical cord blood stem cell. So the first successful cord transplant, umbilical cord blood stem cells transplant was done in 1988. And it was shown that we had a relatively higher success rate, and from the beginning of the search for a transplant compatible cord blood to the actual transplant is as few as 21 days, whereas any other procedure would have taken quite a longer time. And another important or very good thing about this is it's relatively low risk to the mother and the baby. So we're going to see about the cord blood banking in a short while. So it almost does not have any risks to the mother and the baby if done properly. So these are the unique advantages of umbilical cord stem cells. So in umbilical cord collection, usually the blood is collected after the baby has been separated from the mother, and the umbilical cord has been cut and clamped. The baby is separated, and then before the delivery of the placenta, the cord blood is collected. However, any situation where there is high risk, say if the mother is having heavy bleeding or there's some problem in the pregnancy or during the delivery, it is contraindicated. The cord blood collection is usually done under aseptic techniques and stored at minus 80 degree Fahrenheit. So this is how it is done. A sterile needle together with a whole set of cord blood bag. Everything is usually, it comes in a sterile container. And once the baby is separated from the mother, the umbilical vein is punctured with a sterile needle, and the cord blood collection, about 150 ml of cord blood is collected. And if they are saving the umbilical cord as well, a portion of the umbilical cord is also collected and sent under sterile aseptic techniques using the transport system provided, and they have a specialized transport system for that. So what are the advantages of the cord blood stem cell? Blood from the placenta and the umbilical cord is a rich source of hematopoietic stem cells, and it has the advantage of being normally discarded with no morbidity to both the mother and the newborn. And its supply is unlimited, with the possibility of isolation of huge number of cells with no or few ethical considerations. Coming on to the mesenchymal stem cells from the umbilical cord, these are the youngest, most primitive mesenchymal stem cells that can be isolated. And the umbilical cord, as you can see in the diagram, it contains two arteries and one vein, which are surrounded by a mucoid connective tissue, which is called as the Wharton's jelly. So this Wharton's jelly is a very good source of stem cells. And the mesenchymal stem cells especially are found in much higher concentration in Wharton's jelly than in the umbilical cord blood. The umbilical cord is easily obtained from the newborn after birth. The cord is normally about anywhere between 30 to 35 centimeters. So normally when storing the umbilical cord, we take a portion of 15 centimeters and send. Even most of the cases after delivery, the placenta, umbilical cord and the cord blood, everything is thrown as a biological waste. But however, in certain communities, we hand it over to them. So what is Watten's jelly? Watten's jelly is a gelatinous substance within the umbilical cord, largely made up of mucopolysaccharides, hyaluronic acid and chondroitin sulfate, and it also contains some fibroblasts and macrophages. As a mucous tissue, it protects and insulates the umbilical blood vessels, and that is its main function. And this is a potential source of adult stem cells. So umbilical cord stem cells, especially the ones present in both the cord blood as well as the mesenchymal stem cells are of infant origin. So it means they are adult stem cells, but still very young adult stem cells. So they, if isolated prior to or immediately following birth, a huge number is usually available to the count of almost 100,000 stem cells per ml in umbilical cord blood. And majority of the cord blood stem cells are hematopoietic stem cells, and this is a very good alternative to bone marrow stem cells. So the umbilical cord stem cells have three important functions. One is plasticity. They have this potential to change into other cell types like nerve cells. The second one is homing. Homing means they travel to the site of tissue damage, which means if your heart is damaged, when a stem cell injection is given to you, these cells are capable of traveling specifically to the site of tissue damage, and that is called as homing. And third is engraftment. Engraftment means its ability to unite with the other tissues. So let's see what are the applications. Why are stem cells important? Cord blood stem cells have been used to treat more than 80 malignant and genetic diseases. And by and far, the commonest treated one with the stem cells is leukemia. Hematopoietic cell transplantation of umbilical cord origin is curative for malignant and non-malignant diseases like Fanconi's anemia, aplastic anemia, leukemias, metabolic and other congenital disorders. HLA mismatch may be better tolerated in the umbilical cord blood transfer setting than the bone marrow transplantation. That is one of the unique advantages of umbilical cord blood transplant. So malignant diseases, the main one which is treated is acute leukemia. Cord blood from an unrelated donor was found to be useful for adults with acute leukemia who lack an HLA matched bone marrow donor. So sometimes when you are looking for bone marrow donors, HLA compatibility is very, very important, and some people do not get the HLA matched donors. So that is when this cord blood is very, very useful, because the HLA matching need not be that stringent for cord blood because of its lower immunogenicity, and the rejection rates are much lesser when cord blood is used. So these are some of the stories. Like in this girl, her sister's cord blood saved her life. So this, the younger sibling, the younger sibling had major thalassemia, and luckily the parents had stored the older sibling's cord blood, and which matched her perfectly. So she didn't have to go through all this constant blood transfusions and hospital visits, and that cord blood transplant actually saved her life. So what are the other therapies in clinical trials? Therapies for cancers like Ewing sarcoma, breast cancer, renal cell cancers, and inherited disorders like metabolic storage disorders like leukodystrophy, lysosomal storage disorders. All these are under trial, and also disorders of cell proliferation like Langerhans cells, histiocytosis, diseases of the CNS like multiple sclerosis. Gene therapies is indicated in what you call combined immunodeficiency syndromes, and cellular therapies is again in trial for cardiomyopathy. So these are all in clinical trials. We will go through them in a short while. So another thing which is very promising, that we are going to see some of the therapies which are very promising. In corneal disease and blindness, stem cells are taken from the healthy eye and then they are grown onto the contact lenses in the clinical lab. And these lenses, when they are worn by the patient for a period of 3 weeks, these stem cells migrate to the affected cornea and the healing or repair process begins and thus improves the vision. So this is how they take one tiny sample from the good eye, they culture and grow them on contact lenses and put it over the affected eye for that affected eye to heal. And in cardiology, it also there have been very promising results seen. The transplanted umbilical cord stem cells actually provided benefit in the cardiac function recovery after acute myocardial infarction in rats. So these have been actually put to use, and the stem cells have been separated and directly injected to the cardiac muscles, and they have found that this improves the muscle function, or the recovery rate is much faster. So the other experimental treatments are for autoimmune disorders like rheumatoid arthritis or juvenile arthritis, Crohn's disease, type 1 diabetes, like gene therapy for Parkinson's, Fanconi's anemia, and where nerve cells are affected like ALS, Huntington's, and Alzheimer's, and traumatic injuries like spinal cord injuries, stroke, and organ repairs, kidneys, livers, and lungs when they are affected by cystic fibrosis. So all these stem cells have the potential to be used and to benefit the patient. So in orthopedics also, stem cells actually are quite commonly used. They take actually the healthy cartilage tissue, and these tissue culture, culture of these isolated chondrocytes are done. And once the cultured chondrocytes are sufficiently mature, they put them as a patch in the knee. And these are used to treat chondral defects. So this is how it is done. So they take a biopsy of the healthy cartilage and then they culture the chondrocytes and inject the chondrocytes under the patch. And this helps improve the cartilage function. And as we saw earlier, metabolic storage disorders like the mucopolysaccharidosis, Hurler's syndrome, these, these type of storage disorders also can be effectively treated by stem cells. But however, all these are under trials only at this point. So transplantation of umbilical cord stem cells actually improved the neurocognitive performance and decreased somatic features of these metabolic storage disorders. And stem cell therapy has again shown some promising results in diabetes as well. Diabetes patients actually lose the function of the insulin producing beta cells of the pancreas, and that is why they have very high blood sugar levels. Human embryonic stem cells may be grown in cell cultures and they can be actually stimulated to form insulin producing cells, which can then be transplanted to the patient. Also, in diseases like Parkinson's disease, the same method can be applied. So you grow the stem cells and inject them to the brain cells, where these cells can go and create the dopamine producing cells. And other neurological disorders like Huntington's disease, stroke, all these disorders, the stem cells are now being tried in experiments and clinical trials to see how they can be of benefit to the patient. And commonly we see in stroke and traumatic brain injury, which causes the cells to die because the neurons cannot regrow. These situations also people have tried using the stem cells, and they have shown some promising results in recovering the brain function. Another use is in missing teeth. Again, the stem cells from the dental pulp can be cultured in the lab, and these can be grown into a tooth bud and then implanted. So in approximately 2 months, then it will give rise to a new tooth. So these are all experimental therapies. Again, kidney stem cells, similarly, any organ stem cells, you take from the healthy tissue, culture, and then re-inject into the repaired organ to produce or heal the repaired or damaged organ. Again, in hearing loss also, embryonic stem cells have been shown that they are capable of differentiating into the cochlear hair cells, or the cochlear hair cells in the adult inner ear, improving the sensory loss. So these are some of the stem cell researchers. So this patient She had her lower limbs paralyzed after an accident, and after that she spent her entire life in bed. And with stem cell transplantation, she was able to get up and at least walk with a walker. So this to her, I think, makes a huge difference in her life, and that's where the stem cell researches and therapies come. And this child, again, who was diagnosed with cerebral palsy, he did not show much of improvement until his cord blood stem cells were infused into his bloodstream. I mean, normally a stem cell transfer is an IV infusion, which takes only 10 to 15 minutes. And after that, the results have been very encouraging. So again, this doesn't happen for every child with CP. For certain people, it works. So all these therapies, why it works for some and why it doesn't work for some, are still under trials and experiments, and we've still not figured it out in entirety. So if you want to see what are the other therapies in clinical trials, these are some of the websites you can go and search for the current trials and what are the outcomes and how promising they are. So let's come on to the future applications. So stem cells, I've showed you a wide variety of disorders where the stem cells can be applied. In addition to that, in autoimmune diseases also, there has been some amount of success with autologous transplantations, and the low risk of graft versus host disease, which means transplant rejection, makes cord blood transplantation very attractive, especially for autoimmune disease. And in elderly patients with a high risk of rejection chances of graft versus host disease, again, cord blood transplantation is more attractive. And in theory, an HIV patient, you know, who has an allergenic umbilical cord stem cell vaccine may be used to replace the entire HIV infected hemopoietic stem cells. Isn't that very amazing? But again, as mentioned here, it's only in theory as yet. It's still a long way to put it into practice. So these are some of the potential uses where they can be used. The stem cells can be used and are already being used in many centers for wound healing and for skin, for treating the scars. In aesthetics, it's widely used. And certain allergy clinics, they use for asthma and allergy. And alopecia, again, this field is like a very upcoming and booming field with so many people suffering from hair loss and everybody taking more care of their appearances. Again, this is a very this is where one of the widely used stem cells are seen, in aesthetics, alopecia as well as in the skin. And again, in targeted gene therapies and tissue engineering, all these are potential uses. And this is how stem cells are used in treating baldness. As hair follicles contain stem cells, the dermal papilla, these cells are taken from the existing hair cell follicles, and they multiply them in the cultures, and they implant the new follicles into the scalp, which helps the hair to grow. So once these stem cells are injected, so there's a overall rejuvenation and lot of hair follicles develop and the hair becomes more denser and stronger, just thus curing the baldness. This is a very popular area of practice now. So again, these stem cells can be used as cellular vehicles for gene therapies, as some of the disorders needed, as I mentioned earlier, we talked about gene therapy. So these stem cells can be used for gene therapy together with a retroviral vector. So umbilical cord stem cells can be stably transduced using retroviral vectors for necessary genetic correction and can be used for transplantation. And this is how they do. In direct delivery, the therapeutic transgene is directly injected to the patient, but however, in a cell-based delivery, the therapeutic transgene is first packaged into a delivery vehicle or a virus, and then they are actually introduced into the stem cells derived from the patient, and these stem cells are genetically modified or cultured in the lab, and then they are re-injected into the patient to get the desired effect. So this November 2008, another Another is actually a historical moment where the world's first transplant of a whole organ grown in a lab was done. A fully an organ which was fully grown in the lab was first transplanted in 2008. So this is actually a milestone in the field of regenerative medicine, and it was actually a damaged windpipe which was fully cultured in the lab and was uh, was transplanted to the patient. And since it was taken from the patient's own stem cells, there's no or little chance of rejection. So, what does the future hold? Will embryo farms be around in the future, or will organ farms be around? Like we just grew a windpipe in the lab. So maybe in future, kidneys or livers or pancreas can be cultured in the lab. But how? But at the moment, we are still far away from this. These are some of the challenges to stem cell research. The source of the stem cells, from where the stem cells are derived, they may have mutations because stem cells have this unique capacity to multiply or multiply unlimitedly. When they are multiplying so fast, they are bound to have mutations. And again, delivery to the target areas. We are injecting the stem cells in the bloodstream. So we still do not know. We want it to go to the heart, it might still end up going to the liver. So we do not know how accurately to target the areas yet. So again, prevention of rejection. Though the rejection rates are much low in stem cells, especially umbilical cord stem cells, the rejection still exists. So we do not know yet how to completely prevent it. And again, embryonic stem cells with the unlimited potential of differentiating, they can actually grow into tumor. So again, that is again a problem. So suppressing tumors is something we are looking at as well. And stem cell regenerated tissue viability. So we are rejuvenating all these tissues, but how long is the question? So if I inject the stem cells, does it last for life? Or does it last for only 1 year? Again, this is a question which needs to be addressed. And again, the main important challenges are for stem cell researchers are the political and religious obstructions, especially for embryonic stem cell research, whether the IVF embryos can be destroyed and used for research. Is it ethical or not? Because it's a living being. All these are considerations, and certain many of the countries actually, because of these political and religious obstructions, they do not fund these stem cell researchers. As for any research, funding is very, very important, and we do not get the proper funding, then it's very difficult to proceed further. And again, these ethical considerations play a major role in getting the source material also. Say aborted fetuses or embryos. Again, in certain countries, it is actually a crime to get them. So ethics is a very important subject here and plays a huge role in stem cell research. How far can we go with this? Is it morally right or is it ethically right? Are human beings playing God? So just because we're creating, we are creating a windpipe, we are creating a lung, we are creating a pancreas, and one fine day we create a human being or we clone a full human being, are we becoming God? So is the how are we going to infuse soul? These are some of the soul into the newly created being. These are some of the very still unaddressed questions in this field, and people worry a lot about these. We don't want to be playing God and getting into problems. That is what is the other a pool of people who actually who do not want these researchers to go further, talk about or put forth. But so many of our dreams at first seem impossible, then they seem improbable, and then when we summon the will, they soon become inevitable. So, what future holds, nobody knows. So, coming on to the advantages of the umbilical cord blood. So far we've been discussing in detail about all the potential advantages and what you call clinical implications and the clinical trials and experimental therapy, which is going to change the field of regenerative medicine. We've been discussing. So now we will see how umbilical cord actually has a cord blood stem cell has an edge over the other stem cells, and what are its advantages? The main advantage is its unlimited source, because it's cord blood is actually a biological waste. So what is going waste, we are utilizing it. So it is, and every minute millions of babies are being born, so it's available in plenty. So collection of cord blood stem cells is also painless, risk-free to the mother and the baby, and these cells have a greater ability to differentiate into other cell types and have a longer growth potential and have shown greater rate of engraftment. So cord blood stem cells are much more tolerant to the HLA tissue mismatching, which means the rejection rates are very low. So, and these cord blood stem cells, they have obtained as very young cells, young adult stem cells. So these are not exposed to toxins or radiations which we experience in everyday life. And these stem cells, as I've told you earlier, they're used in over 45 medical conditions with over 80 potential disease targets. So, and researchers have been oriented towards prolonging their storage and enhancing their expansion, because these cord blood stem cells are available in plenty for research as well. So these are all the advantages of cord blood stem cells when compared to adult tissue stem cells, which are difficult to get, because getting them involves more invasive procedure and more elaborate procedure, and you cannot harness the same amounts. Cord blood stem cells are available in plenty, whereas adult tissue stem cells are very limited in quantity. But however, cord blood stem cells also have their own limitations. So what are the limitations of cord blood stem cells, especially for allogenic transplant? So cord blood stem cells have a delayed platelet as well as neutrophil engraftment, which means the capacity for this cord blood stem cells to go and what do you call communicate or graft, which means to sit together with the platelets and neutrophils, is much lesser. And also the stem cell source, the cord blood, if you've used one packet of cord blood and you want more of it, you will not be able to get, because you cannot get it from the same donor. But sometimes one cord blood unit is not sufficient, so you need to have 2 or 3. So this second or third one might not be from the same person. So same donor will not be available for a repeated dose. So in summary, what is the difference between cord blood versus bone marrow stem cell, which is bone marrow is a commonly used hematopoietic stem cells, especially for all these leukemias and malignant hematological malignancies. So cord blood, the collection is non-invasive, painless, and poses no risk to the donor. However, in bone marrow, collection is very invasive and painful and must be performed in a hospital surgical setting. And cord blood has a greater HLA compatibility, whereas bone marrow, the rejection rates are quite high. The graft versus host disease is less than 10%. Again, this is about the transplant rejection due to the absence of antibodies in the stem cells. Whereas in bone marrow stem cells, serious graft versus host diseases occur in almost 60% of the unrelated bone marrow transplants. And cord blood, the units are processed and ready for transplant. So they are stored and kept ready. So it's easy. So as we saw in our first slide on cord blood, within 21 days, very easily you can get it. But whereas in bone marrow, it is dependent on the donor participation. And cord blood is significantly less expensive, whereas bone marrow, because it's an invasive procedure, including collecting and then transfusing to the right person. So all these involves cost, so which is much more expensive. So umbilical cord blood banking. So cord blood normally is a biological waste which is discarded in many of the centers. The other things what you can do is either to donate it to a public bank or a private bank. So what are the advantages and disadvantages for each of the procedure? So if you dump it in the dustbin, there's no cost involved, no headaches. You don't have to decide which bank to donate the blood to. But however, it's a waste of these valuable stem cells. When it comes to public cord blood banking, can be used by anyone in need, and increases the pool of hematopoietic stem cell donors. And especially for the minority donors, you have so many people giving blood, so it's easier for them to get a donor, and it involves no cost to the donor. But the disadvantages is it needs public and government financial support. And even though you may have donated the cord blood, there's no guarantee you are going to get the same cord blood. So it's not designated for you or your family. The private cord blood collection A private cord blood collection means you collect the cord blood and store it for your own use, future potential use, or regenerative, maybe for aesthetics, or maybe if you turn bald, you can use it for treating your baldness. So all these are your potential uses. But however, the disadvantages, it involves cost, and probably you might never need these stem cells again, because you're not donating it, and the chances for you to use this is very limited. It is not being available for the needy people. For people suffering from malignancies, it might not be available. Also, these cord bloods are only stored for a maximum of 20 years. So what happens to them? Whether you're going to store it any further? And in case you're suffering from a genetic disease, you still cannot use your own cord blood, because cord blood stem cell will carry the same gene, so it cannot be used. So all these questions come into play. So whether to donate the cord blood to private or public? That's a major question which we will deal with shortly. And these are the steps of umbilical cord blood banking. First, you have to register, and then the collection process during your delivery. You need to inform the people, and then they will come with a sterile containers, and there's a collection kit, and it has to be done in the specific manner. And then it's transported to the lab where testing and processing and preservation are all done. So once the baby is separated from the placenta, then from the umbilical vein, using the sterile set provided, the cord blood is collected. About 150 ml of cord blood is collected, and then in the kit available, they're just transported back to the lab where they are processed and stored. So if you're banking the cord also, a 15 centimeter sample of the cord is also taken and then packed in the sterile container and given. So what is the Malaysian scenario? This was my study for my master's thesis for my MSc. So the knowledge, awareness, and perception of pregnant women in Kuala Lumpur on cord blood stem cell banking. The problem statement, this is the problem statement. Though stem cell research has been in vogue for almost 3 decades, knowledge among the general population is still very limited. Surveys all over the world has shown that people, especially pregnant women, have very limited knowledge about umbilical cord blood and its banking. And in Malaysia, do pregnant women have enough awareness and knowledge on umbilical cord blood banking? That was my question. And at that point of time, there was no literature available. So according to the Malaysian Stem Cell Registry, there are about 18,000 registered volunteers or potential donors, of which only 30% this is only 30% of the total target, whereas private umbilical cord blood banks have more than 80,000 registered people. And statistics also show that more than 3,000 children are diagnosed with leukemia yearly, and there have been more than 500 stem cell transplants carried out in Malaysia. So the need for these stem cells are much more than the availability. So these were my research questions. So what is the level of knowledge, awareness among Malaysian pregnant women with regards to cord blood banking and donation? And is there any association between the demographic factors studied and the level of knowledge and awareness? And what was the perception of Malaysian pregnant women about cord blood banking? So those who were agreeable for cord blood collection were 53%, and 9% said no, and 38% were unsure. The main reasons for not agreeing for cord blood collection or donation was cost of storage is expensive, and they were unsure if the child or family would need it. And some said it was against their religious or personal belief, and they also said, in case if they need, they can use other sources of stem cells. So the major cause here, as you can see, is first thing is they were not sure whether they will need it. The second one was they did not know anything about cord blood donation. So the type of cord blood bank chosen for umbilical cord blood collection was majority of them chose public 36% versus private only 14%, and 50% were unsure about their choice. Again, the main barriers in storing umbilical cord blood stem cells was their lack of awareness as shown in this diagram, and also the high cost and lack of sufficient proven knowledge. So this was my study conclusion. Insufficient knowledge on cord blood banking and donation was a major issue in Malaysian pregnant women, and women who are older and had more children and higher qualification and higher family income had significantly more knowledge compared to the rest, and awareness did not necessarily translate into knowledge. Knowledge and awareness had a direct effect on perception and reflected in their choice of cord blood banking and donation. And what is the status of umbilical cord blood donation in Malaysia? Actually, we have only GHKL and Hospital Putrajaya, collecting cord blood. The other hospitals, government hospitals, do not have proper infrastructures for cord blood collection. And when the patient delivers anywhere else in the private sector too, we do not have any proper flow or infrastructure to donate cord blood. So more than 95% of umbilical cords are discarded as medical waste. Meanwhile, ironically, thousands are searching for cord blood or bone marrow stem cells. And this is the current status. You and I can help us change this. Donate, don't discard. If a small act makes a big difference in someone's life, why not do it? So again, public cord blood banking should be encouraged, and more awareness needs to be disseminated to the population. And again, if you choose private cord blood banking too, it is not a bad option. It's better to have and not need than to need and not have. So consider cord blood, saving the cord blood either in public or private bankings. So in summary, stem cells are master cells capable of developing into any tissue. Umbilical cord blood has emerged as a rich, non-invasive source of stem cells, and umbilical cord blood, which was considered once as a waste product and discarded for centuries, has now emerged as an invaluable source of stem cells, making it a highly sought topic in research with a huge potential to treat several diseases and offer a better quality of life. The versatility of stem cells may be potentially useful in tissue repair, and this area is currently garnering much interest. Today, more parents are seeking information about umbilical cord blood banking and its benefits. The collection and storage of blood from the umbilical cord after a baby is born is called as cord blood banking. This may be done either via a public cord blood bank or ones that are managed privately. Though the procedure is essentially same, the use is very different. The cord blood stored in public banks are available to anyone who needs it either for therapeutic or research purposes. As the storage is done anonymously, the person who donated it will not have access to it. There is no procedural cost incurred by the donor. In contrast, private bank collects and stores the cord blood of the babies whose parents have opted for its service for a fee for later use either for the babies themselves or their family members if the need arises. This may perhaps be a good option for those with family history of disorders which are amenable to treatment with stem cells. However, due to the extensive propaganda and marketing campaigns by the private cord blood banks, some parents misinterpret this as an indispensable insurance policy for their offsprings. At present, there is no scientific evidence or indication for the use of such services. The probability that a child will need its own cord blood is very low, about 1 is to 25,000. So despite promotional media campaigns for umbilical cord blood collection and increasing volume of evidence for their uses, surveys across the world show that there is still a marked lack of knowledge among pregnant women, about 70 to 80% with regards to cord blood banking and their benefits. More information and knowledge regarding this needs to be made available to these potential donors so that they can make informed choices. And that brings us to the end of this session. Thanks for your patient listening.